Bendamustine rituximab, as you know, was popularised in Germany, and the Germans have taken the comparative trials forward and have just presented at ASH 2013 the bendamustine rituximab versus FCR trial. And you know, that trial needs a lot of discussion with patients because FCR is a very effective regimen in CLL. That's the way it is. But FCR comes with toxicity, and the Germans show us that. More chance of infection, more chance of having lowered blood counts, more chance of actually getting the very serious complications such as myelodysplasia and leukemia. But really that needs to be balanced with bendamustine rituximab that has a slightly different toxicity profile and probably overall is not quite as good as FCR. But again, we've got to be very careful. The only trial comparing the two was actually imbalanced in certain key features such as mutated, unmutated and age. So, you know, it's not an easy debate to have with patients, but one that must be had. Well, undoubtedly, FCR is a serious treatment. Now, we in the UK give the fludarabine cyclophosphamide as tablets. So there is that slight risk that patients might think, oh, well, I get my infusion of rituximab and then some tablets, so it's not really heavyweight treatment. But that is wrong. FCR, it is very clear across every trial, has this significant risk of infections both on treatment and following treatment. And so everyone getting these treatments needs to be treated by a centre experienced in delivery of these drugs and needs to have very clear access routes to who they contact if they get unwell and to make sure they have specialist input into their management if that arises.